Hello everyone. In this video lecture, we will be talking about the mechanism of action of cardiotonic drug digoxin, which is the only cardiac glycoside available widely and used clinically now for the treatment of heart failure. Being a cardiotonic agent, digoxin increases the force of contraction of the heart and therefore it is used to treat stage C systolic heart failure, which is characterized by the symptoms like fatigue, shortness of breath and edema. In addition, digoxin is also used to manage advanced stage D systolic heart failure. Drugs like diuretics, ACE inhibitors and vasodilators are usually given in combination with digoxin. Although digoxin is used to treat systolic heart failure, it is not recommended for the treatment of diastolic heart failure, which is associated with a defect in the ventricular filling. Digoxin is also used as a second-line therapy to prevent life-threatening ventricular fibrillation in heart failure associated atrial fibrillation by slowing AV node conduction. Interestingly, digoxin is contraindicated in patients with ventricular fibrillation as ventricular arrhythmias are most commonly seen in chronic digoxin toxicity. Please note that digoxin has a narrow therapeutic index. The toxic symptoms can be observed with normal digoxin concentrations in about 25% of patients. Hence, slow oral digitalization is generally preferred for most patients using a maintenance dose. Also, therapeutic drug monitoring with 0.5 to 1 nanogram per ml of target serum concentration is essential in clinical practice for efficacy as well as to avoid the toxicity. Digoxin has a large volume of distribution, which is 6 to 8 liter per kg. It is concentrated in various tissues, particularly in the heart tissue, which is about 20 times that of the plasma. Therefore, the hemodialysis technique is not very effective in the management of digoxin toxicity. Now let us see the mechanism of action of digoxin. The target for digoxin is the cardiac myocyte. Normally, after phase 4 of cardiac action potential, that is diastole, the membrane depolarization is triggered by the activation of sodium ion channels. This allows the inflow of sodium ions in the cell in phase 0 to increase the membrane potential from minus 90 mV to around 50 mV. Thereafter, phase 1 begins with rapid inactivation of the sodium ion channels. At the same time, potassium ion channels open and close rapidly to allow a brief outflow of potassium ions from the cell, making membrane potential slightly more negative. During phase 2, that is the plateau phase, the L-type of calcium ion channels are activated to allow inflow of calcium ions into the cell, while delayed rectifier potassium ion channels allow potassium ions to leave the cell. Therefore, the membrane potential remains almost constant due to the near balance of charge moving into and out of the cell. During phase 3, the calcium ion channels close while the potassium ion channels remain open, allowing the outflow of potassium ions and causing the membrane repolarization. The potassium ion channels inactivate when the membrane potential is restored again to about minus 90 mV. The calcium entered in the myocyte during phase 2 binds to and activates calcium ion channel coupled ryanodine receptors on the sarcoplasmic reticulum. This triggers the release of calcium ions out of the sarcoplasmic reticulum to further increase the calcium level in the cytosol. The cytosolic calcium binds to a calcium regulatory protein called troponin. The formation of calcium troponin complex activates myosin light chain kinase. the myosin light chain kinase further phosphorylates the contractile protein myosin light chain. The phosphorylated myosin then interacts with another contractile protein, actin. And finally, this actin-myosin interaction results in the myocardial muscle contraction. After contraction, the calcium ATPase pump in the sarcoplasmic reticulum transports calcium ions from cytosol back to the sarcoplasmic reticulum. Similarly, the plasma membrane calcium ATPase pump along with sodium calcium exchanger also causes the calcium ions efflux from the cell. In addition to calcium ATPase pump, the sodium potassium ATPase pump plays a crucial role in restoring sodium potassium electrochemical gradients across the plasma membrane. In cardiac myocyte, the sodium potassium ATPase pump expels 3 sodium ions out of the cell and brings 2 potassium ions into the cell for every single ATP consumed. In case of heart failure, the aim of digoxin therapy is to increase the intracellular calcium level so that the force of contraction of cardiac muscles can be increased. Digoxin causes partial inhibition of sodium potassium ATPase pump, that is, it causes a decrease in functional sodium potassium ATPase pump concentration of around 25%. Please note that digoxin acts on the potassium binding site of the sodium potassium ATPase pump, and therefore hypokalemia, that is low blood potassium level induced by diuretics, can enhance digoxin toxicity. Due to inhibited sodium potassium ATPase pump, the intracellular sodium ions get expelled by the sodium calcium exchanger in the membrane. In this case, one calcium ion is entered into the cell in exchange for 3 sodium ions. This process eventually increases the intracellular calcium ion level. Meanwhile, outer potassium ions also entered into the cell via inwardly rectifying potassium ion channels. The excess of cytosolic calcium is taken up into the sarcoplasmic reticulum and released into the cytosol upon stimulation by the next action potential. This larger calcium release from the sarcoplasmic reticulum results in a stronger force of contraction, and obviously this effect is beneficial in case of the systolic heart failure. So that's all about the direct mechanism of action of digoxin. The another mechanism by which digoxin acts is called its indirect mechanism. Digoxin acts centrally to stimulate the vagal center in the medulla oblongata. This causes activation of the cholinergic vagus nerve. Consequently, the acetylcholine firing increases in SA and AV nodes of the heart, which ultimately results in a decreased rate of contraction of the heart. By virtue of this mechanism, digoxin is given to control ventricular rate in case of atrial fibrillation. So viewed collectively, digoxin increases the force of contraction of the heart by its direct action on the cardiac myocyte and decrease the rate of contraction of the heart by its indirect action via the vagus nerve stimulation. Thanks for watching the video.